Hi, I'm Heather. I'm an occupational therapist. And after you have your hip or knee replaced, there is some adaptive equipment and tools that can help with getting your lower body dressed yourself without having to bend over. Especially after a hip replacement, you have 90-degree hip precautions. So you can't be bending past 90 degrees. You want to keep your hips nice and wide and open. And the knee is also tricky to bend after a joint replacement. So we're going to go over some of the adaptive equipment. There is some nice equipment that can be purchased on Amazon. It's called a hip kit, and basically it will help you get your pants and socks on. And so in that is a reacher. A lot of people have these at home that they pick things up with or get in the cupboards with, but it can also be used to put your pants on. And so you're going to take your waistband of your pants and you're going to put it in the little claw, and you want to, and then all of a sudden you have a long arm, and you want to put your surgical leg in the pants first, just because it's harder to move. So thread your foot in and bring it up until you can reach it. And then you can use your hands to pull it up the rest of the way. Depending how mobile your other leg is, your non-surgical leg, some people can just bring it up and put it in. But if that leg is bothersome as well, you can use your reacher to make your really long arm and put it down until you can also get that foot in. And then bring it up until you can reach it with your hands. Once both feet are inside the pants or shorts or underwear, pull it up as far as you can, up around your hips, because then you're gonna stand with your walker, and you want one hand on the walker while you use your other hand to pull the pants up over your hip. And then you can switch hands and pull the other side up over your hips. And then your pants are on. And so to take them off, you're just going to do the reverse process. One hand on the walker, one hand pulling the pants down, and switch. Once you get them down to your thighs, you can have a seat. And then you can use your reacher here to just kind of push them down. And you put your surgical leg in first. You want to take your surgical leg out last. So it's totally reversing of the process. And you can use your reacher to pick them up off the floor. This is a dressing stick, and it also is part of the kit and can be used to get your pants on. The hooks on the end can be used on belt loops, but you can also use it on regular pants or shorts or underwear by gathering up the leg and hooking it in there. And then you have your long arm again to put down and put over your foot, and just kind of work it up until you can reach it. And then same thing, the other side, you can just kind of hook it in the waistband so you can get your other leg in there. And then you're gonna do the same thing with standing up one hand at a time on the walker to pull them up over your hips. And then you can use this to push them down when you're ready to take them off. Again, you take it off your surgical leg last. You can bring them up. Another gadget that's in the hip kit is a sock aid. So socks are one of the hardest things for people to get off and on, even before a knee replacement, but especially after. So you hold this in your lap, and this serves as like the bottom of your foot, and you're gonna put the sock on it as if that were the bottom of your foot. And you just want to pull it all the way on. Make sure it's nice and flat down here. And then you use the ropes, drop it to the floor, and kind of point your toes, maybe slide put it down and slide your foot all the way to the bottom. And you can wiggle a little bit, do some ankle pumps as you pull the sock aid up, and then your sock is on. If you need to adjust it a little bit, pull it on a little more, you can always use your dressing stick, your reacher, and grab it to pull it up. When it comes time to take your sock off, you can use the dressing stick and just kind of get behind your ankle is the easiest way, and then just pull it on off, and then you can use your reacher to pick it up. When it comes to footwear, you always want to have supportive footwear, and that includes having a back on your shoe. Don't go around in slippers or shoes that don't have the back on them. It just increases risk for fall, and we want everybody to be safe and successful with your journey and your hip replacement. So if you have elastic shoelaces or a slip-on shoe, those are the easiest, however, because otherwise you're going to have somebody help you tie your shoe or tie it ahead of time. But put your long-handled shoe horn in the back of your shoe, and it will help hold the back up while you slide your foot in, and then you have your shoe on. And you can do the same thing to get your shoe off if needed. Just put the shoe horn in the back and push it and slide your foot out. Again, trying to keep your toes pointed straight towards the ceiling as much as possible to avoid breaking the hip precautions. And then the last piece of equipment that comes in the hip kits is a long-handled sponge. So this will give you that extra length you need to clean your feet, clean your legs, without having to bend over or break those hip precautions.